There are really three areas where advanced practice nurses are impacted by issues of law and regulation. The first is the medical malpractice lawsuit that can be filed, which is a civil case. The second is an administrative licensure issue, which can occur. And the third is based on criminal charges. So I think the big thing to take away from this is there are keys to prevent these issues. The first is good communication amongst the healthcare providers and with the patient. There is good documentation that is clear, consistent, timely, that can be evaluated when you go back, because lawsuits generally happen 2 to 3 years after the care that's actually taken place. Keeping current in practice and being able to demonstrate that you're keeping current in practice because you were evaluated by the practice of your colleagues in that area or state or community. So you're compared to what's called a reasonably prudent advanced practice nurse. So you want to make sure that your practice is up to date. And another couple of key things is if a mistake is made, own up to it in a timely fashion with the patient and then apologize. And usually your institution or clinic will provide a reimbursement for any cost of treatment associated in further care. So those are the really big things. A couple of things to know specifically about administrative actions is they're similar to the course that happens in medical malpractice, but there does not have to be patient harm associated with an administrative action. And it can just be based on a complaint to the Department of Health, or it can be based on even a media report. And it is very similar. There is an investigation that goes on to determine whether or not there was actually patient harm or potential patient harm. And the course goes the same way. And again, those issues that I just listed out to help prevent medical malpractice lawsuits apply again to administrative actions. Finally, the criminal area, the key focus right now is narcotic prescriptions, diversions, and a key is making sure that if you're prescribing Schedule II drugs to a patient, you know that patient, you know the patient's need, you've reviewed the medical record, and you're ensuring that the patient is actually taking the medication. Because right now the DEA nationally has a huge focus on Schedule II drugs, and as we know, cancer patients need Schedule II drugs. So those are some of the brief overview of what my topics were.